Eric Ding is a nutritionist and epidemiologist. He is a faculty member at Harvard Medical School and Brigham Women's Hospital and founder and chair of the Campaign for Cancer Prevention. His research primarily focuses on obesity and nutritional risk factors for diabetes, heart disease, and cancer, as well as the translation of research for population-wide prevention. After completing his undergraduate degree at the Johns Hopkins University with honors in public health and election of Phi Beta Kappa, he earned his dual doctorate in epidemiology and doctorate in nutrition at age 23 from Harvard University, where he was the youngest ever graduate from his doctoral programs. At Harvard, Eric has taught and lectured in more than a dozen graduate and undergraduate courses for which he has received the Derek Bach Distinction in Technology Award from Harvard College. In addition to teaching, he has published in the New England Journal of Medicine, in the Journal of American Medical Association, and researches global disease burden and nutritional risk factors for chronic diseases at Harvard. His more than 36 publications have received over 650 external citations, garnering an H-index scientific impact factor of 11. He currently also serves as senior associate on the board of the Global Microclinic Project. Eric Ding is an elected fellow of the Paul and Daisy Soros Foundation for his key role in leading a 2-year-long investigation into the controversial drug safety of Vioxx, a study Dr. Eric Ding published which drew national media attention. A lifelong cancer prevention advocate, he has worked closely with causes on Facebook to build up the Campaign for Cancer Prevention, currently with over 5.7 million members on Facebook. To date, his efforts have raised more than $225,000 for cancer research. And with that, I would like to welcome Dr. Eric Ding to Google.
Thank you, Matt, for the introduction. And thank you, it's a pleasure being here. Today, I would like to present to you a very interesting study that we did at Harvard. And it's interesting for many reasons. As all of you know, probably preaching to the choir, but obesity causes a whole variety of diseases, from heart disease to cancer, and of course increases mortality. So if everyone knows this already, then why are we here? For many reasons. And notably, why are we discussing Major League Baseball? And this is the study we're going to cover that spans 130 years and actually has a very profound impact and results beyond just baseball and beyond just body mass index and mortality. And you'll see why. So I have no disclosure. Babe Ruth, for those who are familiar with baseball, is one of the most famous baseball players of all time. And he was also famous for being one of the most obese as well. However, he wasn't always quite so obese when he first joined the major leagues. He actually started at 215 pounds, which is a BMI of 27. We'll go into the details of the BMI index later. But later on, he gained substantial weight and was quite significantly obese at the height of his playing when he was with the New York Yankees. In more modern times, you may know Barry Bonds. He was very skinny rookie in 1986, but today he's known as one of the heavy sluggers of Major League Baseball. So body mass index, why does it matter? It's an index of relative body composition for guiding healthy weight, and generally reflects body fat, and generally is actually the purpose of our talk here today. However, the calculation is very controversial. However, the World Health Organization defines normal weight as between 18.5 and 25, overweight as over 25, and obese as over 30. However, this classification is very controversial, and many people actually dismiss it. So how big of a problem is this? 2 in 3 adults in America are actually overweight and obese. This is quite a substantial epidemic. And for those who are familiar with the term epidemic, but don't actually know the history of the obesity epidemic, let me give you a quick rundown. This is the obesity trends in the US between 1985 and 2009. And it's very self-explanatory. This is early 80s, late 80s, 90s. The prevalence of obesity, you can see, is escalating exponentially in every state. In 2001, a new color is added for Mississippi that first ever topped over 25%. But it keeps going. In the past 10 years, we've actually had to add another color, Mississippi leading the way again. But pretty soon, by 2009, no color is blue anymore, the light blue anymore. And you can see the comparison, the stark comparison between the early 90s and 20 years later. And this is where we are. But we all know that. But what's the implication and the linkage with obesity? So what's the story? What's the story and what's so special about athletes and baseball players? Here is the problem. BMI is generally recognized as an index of obesity in the general population. However, everyone knows it's just a simple calculation of weight and height. And weight is influenced by many things, most notably muscle mass. So if you're an athlete, you run a lot, or you weight lift a lot, and you have a substantial amount of body mass, you can look like the guy on the left. But if you're sedentary, you can look like the guy on the right. However, just a doctor taking your height and weight would not be able to differentiate the two. And that's a limitation of the body mass index, because you can have the same weight and same height and same BMI, but look completely differently. And obviously, we would know who's more likely to die. But the question is should the athlete on the left ignore his body mass index? Because everyone says, oh, I'm heavy because I have a lot of, muscle mass. It doesn't bother me. It doesn't affect me. I don't need to listen to BMI guidelines of obesity. However, is that true? So the controversy is, it's long been a measure of obesity. However, it's not generally well accepted among athletes, and especially those with high lean body mass. So is it even relevant for athletes in terms of health? So whether you are a professional baseball athlete, or you're a runner, or you're a weightlifter, I think this question applies to many more of us than we think. So the objectives of the study. So the scientific jargon's laid out on the left of why we did this study. But plainly, we want to ask, are baseball players getting fatter over time? Does BMI increase the risk of death among these major league athletes? And how does home run hitters play? Because the results we get are quite striking. And home run hitters, for those who are not familiar, are notoriously the largest players in the MLB. So the study design. So what we basically did, we took the entire history of Major League Baseball from 1870s. There's been 5 major leagues, and we compiled them all together. And we know basically baseball is a very unique sport where everyone is a statistics nut and tabulates basically every single statistic ever recorded during play, including height, weight, date of birth, date of debut in the major leagues. And so we tabulate from all these major sources, including many official databases used by the Major League Baseball. And from there, we calculated body mass index from the height and weight from the historical records. We know exactly the date of birth, date of debut, and that's our baseline. And then we ascertained the mortality in all these databases from historical records, obituaries, and Social Security death index. And basically, we have a near perfect follow-up for baseball players, even dating back to the 1800s, because baseball does have that complete of a history. So in terms of analysis, we did some multivariate regressions, but most notably, we did time-to-event analysis, where we asked specifically, do baseball players who are more overweight die sooner? And that's what the relative risk answers. Basically, does it increase the risk of dying and dying sooner? And again, the baseline was 1876 and onwards for whenever the baseball player debuted into the major league. And we have end of follow-up through the end of 2007. The raw count, over 131 years of Major League Baseball, we have 7,400 deaths among 15,000 Major League Baseball players, which is pretty much almost all of Major League Baseball. And we have a total of 500,000 person years of follow-up across 130 years. So the general characteristics, well, body mass index, 24, like medium weight. You don't expect baseball players to be skinny, but we overall had 43% overweight, but that's across all years. And for the most part, they were in their 20s and retired just before they're 30. So this is the raw distribution of BMI in these players across all these years. It's pretty normal distribution. But the story is much more complex once we break it down by year. However, how overweight are baseball players? Some people say baseball, you don't have to be the fittest Olympian to play baseball. But in terms of other sports, we can see the NFL, National Football League, the prevalence of overweight is basically 95% or higher. Compared to NHANES, which is the US national population, it's about 60%. And then 20 or 30% obese. So in terms of baseball players are about 60% overweight and only 2% obese. So if anything, baseball players are not only healthier than football players, no big surprise, but they're also much healthier in terms of body mass index than the general population. So they're very, in general, you can pretty much say, this is a very lean population, and this is their height and weight at their date of debut, which is basically when they are the most fit and the peak of their performance. So, some quick stats. Well, this is the actual tabulation of the body mass index across 130 years. That is a scatter plot of all 15,000 people. And the red dots are the mean BMI. And you can see 25 being the threshold for being overweight. It hugged under 25 for many years, but in the recent 20 years, it's definitely surpassed a mean BMI of 25. And hence, you can see the obesity, the overweight prevalence is substantially increasing. So the temporal trend, just quickly summing up the last slide, 32% were overweight prior to 1880, but by the most recent decade, we have over 55% who are now overweight. And home run hitters, notably, were more than twice as likely to be overweight than non-home run hitters. And with a doubling of odds of being overweight for every 10 home runs batted per season. And the home run hitting story does not end there. It actually gets much more interesting. Yes? Home run hitting is, well, we use a continuous variable. So we can either categorize, because home run hitting in 1920, if you hit like 20, it's considered very high. But if you hit just 20 today, it's not very high. So we didn't use an absolute cutoff because it's such a century difference. So we used for every 10 additional home runs hit per season. So you have, per every 10 additional, you have doubling of the odds ratio of being overweight. Make sense? So this is basically the main result. The main result that body mass index of players at the playing debut and the risk of mortality. For many people who've been following the news, a few years ago, there's been studies that says overweight is associated with lower deaths. Not true whatsoever in many other studies. And also not true among athletes. Because athletes, if anything, many suspected that being overweight as an athlete does not increase your risk. And only when you get to the obese level, does it make your increased risk be present. Because overweight among athletes generally reflects lean body mass and muscle mass. So this was actually much stronger than we anticipated. Because if anything, we only anticipated increased risk in the overweight, in the obese range above 30, the last category. However, compared to 18.5 to 22 BMI, you can see the increased risk start as low as 25 to 27, which is the low end of overweight category. And this was very significant, with higher BMI increasing the risk of death starting at 25. So the key findings. BMI is strongly associated with risk of total mortality, or in other words, it's associated with risk of dying early. And these results are adjusted for the age and the decade that they played, because players are fatter today than they were in the decades past. But this reflects not simply the decade phenomenon, because we adjusted for age, decade, and a wide variety of covariates. So this truly does reflect BMI, not a temporal trend. Risk increases seen as low as a modest 25, which is very surprising, because my BMI is actually a little over 25 myself, I'll sheepishly admit. And with almost a doubling of risk, of 94% increased risk among obese players. But also, someone once posed this question, well, there are half the players who are really obese, really out of shape in baseball, because all you have to do is run one base, and you can be fast sprinter and still be very out of shape, because that's all you have to run is like basically a base length. But if we stratify all these results, and we look among those with high number of stolen bases, which basically are the leanest, fittest sprinters in Major League Baseball. These super lean, fit sprinters, actually, you saw the same phenomenon. So it doesn't matter if you're just a designated hitter who may be quite overweight and out of shape, or if you're actually a sprinter with high stolen bases. This increased risk still holds up. Now, the home run hitting is when the results get extra interesting, but also disturbing. The increased risk of death with overweight was actually stronger among home run hitters. Well, earlier I said home run hitters are more overweight. And, you know, of course some of you would easily think, oh, of course if they're more overweight, they're more likely to die. But the story is not that simple. They not only they had stronger risk of dying, but there was an effect modification. In other words, the effect differed for BMI and mortality, whether or not you are a home run hitter or non-home run hitter. Specifically, home run hitters with one additional home run average per game had 15-fold higher risk of dying sooner compared to overweight players who hit fewer home runs. This is quite surprising because you're comparing overweight individuals to overweight individuals, but per additional home run, they have a 15-fold increased risk of mortality. This is basically saying that this is a general trend among all baseball players, but this slope is actually much steeper among home run hitters. So in terms of what that means, we can only speculate. Some people suggest steroids. However, steroid use, however hypothetically prevalent it is today, it's only been a phenomenon in the past 20 years. So, but in terms of mortality across 130 years, this reflects something, I think, much deeper that we are not quite sure yet. But the strength of this magnitude is very surprising, and I don't think it should be ignored. And again, no such home run of hitting mortality risk seen among non-overweight. So if you're non-overweight and you hit more home runs, you have no increased risk of death. So it's a double-edged sword. It's a double whammy to be overweight and home run hitter. So in terms of Major League Baseball, what they really care about is, like, are bigger baseball players better baseball players? Because if they're bigger, for all they care, you can be as big as you want. If you can hit all the home runs that your team needs, basically your salary go up and no one will care about your health risk. But in terms of actual implementation, in terms of actual salary and compensation and other performance measures, does a bigger player mean you are a better player? And so this is just for Major League Baseball curiosity's sake. And when we graph it, this is total hits and total runs batted in, RBIs, by body mass index. The total hits is blue, total RBIs is orange. And you can see that the higher your BMI actually goes back down. It's bell-shaped instead of a positive slope that you would expect from more overweight players who can supposedly hit more home runs and other hits. So there's no performance correlation between bigger size and total hits and runs batted in. In terms of home runs, this is what everyone is hoping the payoff would be. The bigger the player, the better the slugger. But that's not true at all. There's a simple bell-shaped association, and there's no general correlation or association whatsoever. So are larger home run players being overpaid? I don't know. And in terms of batting average, this is as null as it gets. basically there's absolutely no association, correlation between body mass index and playing and batting statistics. So again, you're not paying for any premiums by hiring and retaining more overweight players on your team. But what is the bottom line? Body mass index and player performance. No relationship whatsoever. So in terms of summary, baseball players have become significantly bigger across 130 years of professional baseball history, with home run hitters being substantially more overweight than players with fewer home runs, and higher the BMI associated with higher risk of death, and as modest as a BMI of 25, which is actually very modest by overweight standards. With home run hitters, again, getting the brunt of the mortality risk. Because for home run hitters who are overweight, they are substantially, and by substantially I mean 15-fold greater risk per additional home run a game, which is quite significant. So in terms of future work in this area, well, there's much to be done, because the mortality I presented were only for all-cause mortality, not mortality broken down by specific causes. We want to break it down by cardiovascular causes, cancer causes, deaths from other cause, accidents, and so forth. However, this requires obviously substantial funding for staff and national death index search. And there's also a wealth of other data about player performance, injury rates, as well as left-handedness, right-handedness, and of course there's many other sports we should verify this. And if it holds among baseball players, then surely among football players with 95% prevalence of overweight and 5-fold greater prevalence of obesity, the risks are probably much higher and worse among professional football players. However, these are things that we look forward to studying in the near future. Thank you very much. And that's my link for the Campaign for Cancer Prevention if you're interested. And I understand we have some time for questions. Yes. The raw data is available. It's online, actually. And so this is what's so interesting about this project, because the data was derived from online resources. They're open access. However, the playing data is not in the same data as the mortality data. And to get them to merge, so you can access them player by player. And you can access the raw data set for the playing, but the mortality data, the raw data set is not, it's by request. However, once requested, you have to merge the data set together, which takes quite a bit of time. We're compiling from the different data sets and merging all 15,000 players. But that's actually how we accessed it.
Hi, Eric. I was wondering if you've shared the results from this study with the Major League Baseball and what their reaction has been, or I have individual baseball players. If you've heard any comments on this, like in the media.
Well, when I presented this abstract previously, and it did get some media coverage. However, the commentary from, I don't believe, we didn't get direct commentary from them. However, one of their team physicians for one of the major league teams commented, and he says, well, this tells us what we know all along, that you should keep your weight down. But I don't think but when reading the article, I don't think they quite grasp it, that we're talking about not only that obesity is increasing among baseball players, but also that the mortality risk is increasing about baseball players, that the mortality risk actually come from the 130 years of baseball players. And that, as low as BMI of 25, you see increased risk, which basically covers 70% of all baseball players today have a BMI of over 25, which is quite disturbing. And basically, they're all at elevated risk. So in terms of direct commentary, no. But in terms, we have gotten a few small commentary, but not official commentary. Any other questions? Yes?
Is there a similar study for women?
In terms of women, among women athletes, there's not such a long-standing cohort existence because most female professional leagues didn't emerge until the past 2 decades at the earliest. And so those players who were playing then, almost no one has died yet. So in baseball, we're able to benefit because baseball has such a long-standing history, and you can accrue 7,000 deaths to do such a study. You can't even actually do it with National Football League, actually, because in terms of the total number of deaths, NFL is actually a very young league. And same for basketball. It only dates back to 1930s, 1940s. So the total number of deaths that's accrued to study the mortality risk is very limited for other sports and very, very limited for women, unfortunately. However, the findings definitely do hold up in women because they've been done the Nurses' Health Study, for example, based at Harvard, which has over 150,000 women in each cohort, so 300,000 women for the past 20, 30 years. And BMI definitely increases risk, similarly in women as well as men. But in terms of actual athletes, unfortunately, we don't have women. Yeah.
I was wondering, just early on in your presentation, you showed slides of how in the United States, state by state, the obesity rate has just been going through the roof, each decade. And then I'm asking about the relationship between basically the general public's obesity rate rising and the rise in obesity among baseball players. And I was wondering, is the baseball player rate rising faster than America as a whole, or is it or is the baseball player rate just a reflection of Americans getting fatter?
Well, that's a very good question. In terms of trend, we don't have quite good data on the prevalence of obesity back in the 1800s. However, if we answer today, for example, NHANES here, shown here, is a nationally representative US sample for US adults. And so here, you can see that overweight is similar. However, obesity is 25% among NHANES. However, only 2% among these baseball players. So baseball players are much leaner than the general population, as expected, although it's opposite for NFL. However, in terms of actual trend, it's hard to say because the actual trend, we don't have the trend data for as many years for national prevalence. But it's likely that the epidemic is very, very similar. Although in the past 20 years, I would say looking at the graphs, the evolution of obesity, it's gone up substantially faster in the general population than in baseball. Yes?
I was wondering about the causes of obesity and particularly the long-term trend. So, for example, I could imagine between, coming to the 1800s to maybe 2000 or whatever, that we're just, there's more prosperity and we're healthier. But I just can't imagine that between, say, the last decade or the last 2 decades, that prosperity has changed that much that people are, diets are changing or whatever that much because of just economic reasons. Yeah. So to what do you speculate or attribute the causes
among
of obesity?
General population or among baseball players?
Well, either, or let's say both, and particularly why it continues to go up recently.
Mm-hmm. Well, of course, obesity, it's a multifactorial disease. There are many causes, contributions, such as greater sedentary activity. We're all in front of the computers much more than we were in the 80s. We don't exercise as much. There's a whole host of environmental reasons, such as bike paths, the suburbanization of cities, and having to drive more. And then there's dietary reasons, of course, like potentially sugar-sweetened beverages like Coca-Cola, proliferation of Coca-Cola in the past 20 years. There's many other risk factors. And basically, a lot of foods have gotten cheaper. And it also, the proliferation of fast food. In terms of actual obesity, the causes are endless. But in terms of Major League Baseball, so it partly definitely reflects an increasing trend among the general population. However, again, perhaps there's more motivation now to use steroids in Major League Baseball. Not that all baseball players do it, but there's much more propensity to want to use it, and the rewards for hitting more home runs have increased ever since. Because, in the past basically 100 years before the recent 2 decades, baseball playing was pretty much an amateur paying sport. It's a professional sport, but the pay of it was mostly like a middle income class. Well, today is to the level of superstardom, and the compensations, and so they basically, the desire to be bigger and hit more has also increased. So I think in terms of general population, diets, physical activity, our environment has substantially changed. But in terms of baseball, I think also there's many other potential motivating factors that we can speculate more on. Any other questions?
You can repeat this in the mic. I was wondering if your study covered at all diabetes rates, because I know you do a lot of research on diabetes, but diabetes among baseball.
So the question was, do I have any data on diabetes risk and incidence of diabetes? It's a good question. However, again, we only have mortality, and we only have total mortality, because we only know the date someone died. To get cause of death, we need to go to death certificates of of all 7,000 players and counting who have died. So we do not have the resources to fund such a huge endeavor at the moment. And in terms of diabetes incidence in linkage with medical records, first of all, most medical records are not electronic linked in the United States, and getting access to current players who have not yet died, the medical records, you would need informed consent. And for past players, you have to track down the families. So it's unlikely we can get disease incidence data. The best we can do is get disease mortality data, and that even takes substantial funding at this point. However, obesity is one of the strongest predictors of diabetes. With increased BMI of 35 or 40, you have basically 40, 50-fold increased risk of diabetes. And so with increasing BMI, it's a foregone conclusion there's also increased risk of diabetes, cardiovascular disease, and cancers, and many other obesity-related diseases. Yes?
How trustworthy are the heights and weights in people's stats? I can imagine a lot of players may lie to seem like a better athlete in the way a lot of people will lie at the DMV about their weight.
That's a very good question. In terms of how trustworthy the weight is, we actually got height and weight from 2 different sets of data. And they had a near perfect correlation of 0.98, 0.99. So they're independently verified. In terms of actual reporting, this is their debut weight. And so in terms of historical records, I'm sure there's not as much fudging the numbers in the old history books. In the current history books, even if there is a little fudging downward the thing is, among baseball players, do you want to list your weight higher or lower? It depends. And it's unlikely to bias the results, because those who fudge their numbers do not know their future mortality outcomes. And basically, it's random misclassification. It's non-differential misclassification compared to the disease outcome. So only if they actually knew they were going to die sooner, higher risk of soon dying, and they fudged their numbers, would there induce any bias. And that's very unlikely in this kind of data set. But a really good question. Well, thank you all for coming, and please contact me if you have further questions. It was a pleasure.